The city government of Cebu continues to monitor the situation in hospitals amid a continuous uptick in cases. For the latest, we have Cebu City Acting Mayor Michael Rama joining us now via Zoom. All right, do we have any further updates on unpaid claims by PhilHealth to hospitals in Cebu City? Has the state insurer responded to your call for them to pay up immediately?
I wish they will be responding. I've not been hearing any news or breaking news on the stand of PhilHealth because I've been in contact with our medical services and the hospitals. Common are their gripes, and that is they're having some collectibles, and some would even reach almost $500 million. I wish PhilHealth should take notice on this because that can always be a problem on management operation of hospitals.
Right. Sir, how do you plan to address the city's high hospital utilization rate and demand for oxygen? We have seen some photos going around social media of oxygen tanks outside the curbs, outside hospitals, sir.
We are working it out first within the city of Cebu. We had our emergency operation center led by retired General Mel Feliciano taking charge to put order so that hoarding will be avoided and then fair distribution to medical services will also be provided. Number two, we've already been aggressive in our TTMF. That is one of the concerns, whereby we have to fast track our gymnasium or sports complex will be open in due time, and then our hospitals will be added up with 3 floors, and that one hospital temporary area building will be converted of the new COVID patient. Then our another facility from over 100, we would like to expand it to 300 bed capacity. And definitely, we are addressing also our medical staff requirements.
Right. Okay. The connection seems to have hung, or it's a little bit choppy. I think.
Cebu,
Yeah.
just hello, Sean.
Yes. Hello. Yes, you're clear now.
Yeah, just approved about 4.5 billion, and $1 billion of that will respond to our medical or our healthcare system. So, with respect to the oxygen, even the governor have also taken cognizance and step to bring all these suppliers. Plus, nananawagan po kami from the national agency, especially DTI, assisted by the police, so that this wrong buying of oxygen should be stopped, because oxygen are supposed to belong to the hospitals. Because if you're going to be having this kept and the number will be bought by any Tom, Dick, and Harry, it will create problem on the circulation of the availability of tanks.
All right.
So this matter is being addressed now.
All right, good to hear that you can manage it all within Cebu without the help of the national government. But is there anything you're doing to address a possible shortage of hospital personnel? We understand that bed space is easy to expand capacity of, but without the proper healthcare workers, what would happen? And are you asking any help from the national government for an augmentation in medical staff?
First, we have sufficient number of medical staff in our needs. It's just bringing them back to be available. And the city government, I've already made my directive to the city administrator, so with our budget in charge, to allocate, because we are willing to give an incentive to any who will be working in the private hospital, available nurses or medical staff, 10,000 more or less a month, and that will bring them, and we will bring them to be assuring them for a continuing 3 months, 10,000 more or less incentive for each medical staff.
Right, very, very good to hear. Sir, at this point in time, would you say that kaya pa ng Cebu? Can Cebu still handle this surge in cases at the moment?
I would be too sure because with all of them coming out, but if there will be also others who might be willing to come to the city of Cebu to augment, why not? But if all our medical staff that are still at home, perhaps not been involved yet, and they will be coming in, my office will be willing even to talk with them and bring them to the dashboard so that they can be available to be dispatched in any of these private hospitals. Kasi marami namang available beds in the hospitals. It's more on the medical staff, Sean. Medical staff that is lacking.
All right, thank you so much, and hoping for the best and praying along with you for the people of Cebu. That was Cebu City Acting Mayor Michael Rama over Zoom. Thank you so much, Mayor.